Hello everyone, and welcome to the US Open Health Desk presented to you by Mount Sinai Medical Center. I am your host, Shawna Ryan, and joining us today is Dr. Abigail Allen. She is the Chief of Pediatric Orthopedic Surgery at the Lenny and Peter W. May Department of Orthopedics at Mount Sinai Medical Center. Dr. Allen, thanks so much for joining us today.
Thank you so much for having me, Shawna.
Right now, in the US alone, there are 38 million kids that participate in organized sports. I'm curious, doctor, what age do you feel is appropriate for kids to begin playing organized sports?
I personally think that as soon as you're able to walk, you should start participating in some kind of activity. So then just tailor it towards the age of the child. You can't overdo it at whatever age they happen to be. So when you're 2 years old, run around and play tag a little bit. But then when you get older, maybe start integrating tennis, but very lightly. And then so it really depends on the age.
Are there specific ways that you find are really helpful to help prevent injury in children? Things that you notice that are good practice?
You have to first remember that children are not small adults. So you don't treat them exactly the same way, but I think some of the common themes would be, you don't want to go into a sport cold. So try to start warming up first. This is extra important in children because they have growth centers, growth plates, areas of growth that the tendons attach to. So you really have to kind of stretch them out before you're putting a lot of pressure on them.
Are there some common injuries that you happen to notice, unfortunately, with children?
The injury is going to occur wherever the weakest link is. So in children, that's actually the bone, more so than the ligaments.
What is a growth plate injury? I've heard of that a lot.
The growth plate is I guess a colloquial way of saying the areas in the children's bone. It's usually each long bone has one on the top and one on the bottom of the long bone, and it's where the cells just spit out and how the bone grows longer and longer.
So what is a sign of a growth plate injury?
You're going to have swelling, you're going to have pain there. You diagnose it on an x-ray or maybe even an MRI.
Another term I've heard is repetitive motion injuries. What are the challenges there?
These growth centers are attached to ligaments and tendons. So what happens is that you have to make sure that you stretch them out appropriately before doing your sport of choice. But then if you continually do the same sport 4 hours a day, you're eventually going to put strain on those growth centers that an adult wouldn't do.
I'm curious, is there any kind of training that you recommend that kids partake in to stay injury-free, to help combat injuries?
Stretching, again, you have to make sure your muscles are adequately stretched out so you're not pulling on those growth centers. The bones grow at different rates than the muscles. Everything doesn't grow all at the same time, so sometimes the muscles can be a little bit tighter relative to their longer bones all of a sudden.
Thank you so much for watching us here on the US Open Health Desk presented by Mount Sinai. Don't forget to continue to check back to the video section at usopen.org throughout the entire tournament for more tips and information from our doctors. I'm Shawna Ryan. Until next time, we'll see you here on the US Open Health Desk presented by Mount Sinai.